There are efforts to cut the red tape on medications intended to prevent the transmission of HIV. That's the idea put forward by Texas Representative Benton Jones. The Dallas Democrat filed a bill this session to prohibit insurance companies from requiring a prior authorization for that medication. This afternoon, Christopher Hamilton, the CEO of Texas Health Action, is joining us here in studio to give us some more insight about this legislation. Christopher, welcome and thanks for being with us.
Yeah, thank you for having me.
I'm very glad you're going to be here to talk about this topic. So talk about the process that looks like now to get medicine like PrEP and how this legislation would potentially change that.
Yeah, so whenever somebody's interested in starting PrEP, the first thing we would ever recommend is talking to a provider about that. Is this medication right for you? That's one of the most important steps that somebody could take. If somebody decides and has that appointment, great, they're going to talk to their provider, talk about their sexual activity, have an open and honest conversation with their provider, someone that they can trust. Then we're going to do some lab work and then prescribe that medication. One of the problems that we see right now, though, is that prior authorizations can get in the way and add delays to that time. Most health insurance plans like Obamacare or ACA plans cover PrEP with no cost sharing. I mean, that's not money coming out of your pocket for this, or other health insurance plans. So the plans have to provide the care, to provide the medication, but they're putting in this delay for it. So that's one of the problems that we see and hope that this bill will address.
Yeah, in what ways would the bill address things like that?
So this bill, this proposal from Representative Benton Jones, eliminates those prior authorizations. This is really the insurance company asking your doctor to submit more information and get almost like a special permission to prescribe that PrEP medication that is going to be covered anyway. With HIV prevention and HIV care, days do matter. There are medications like post-exposure prophylaxis where that has to start within 72 hours. You cannot wait. And so having a clear and easy way to access that medication when somebody is ready to start it is the best chance that we have at eliminating HIV transmission in our communities and making sure that that individual is taking care of their sexual health in the way that works for them.
You mentioned that this could create delays for patients out there. So what kinds of impacts has your group, Texas Health Action, seen because of prior authorization for a medicine like PrEP?
Yeah, it can take anywhere from 3 to 5 days to resolve that prior authorization. And you know, maybe if you live in Austin and you can get to one of our kind clinics fairly easily, that may not make a huge difference for you, but we have patients that come from all over Texas. And so if you have to go back to your community and now you're waiting for that prior authorization to take place and then you have to find the time to go pick up your medication, that length of time before you can start really starts to stack up. It takes anywhere from 7 days to 20 days, depending upon the sexual activity that somebody may be engaging in, for PrEP to reach its most effective state in the body. So like I said, that time, that dragging out of days really adds up for people. And if somebody can start as soon as they're ready, that's the best prevention.
And this legislation that Benton Jones brought forward in the House has not yet had a committee hearing at this point, which would be the first step for people out there to realize that the bill can maybe advance to a full vote in the House. Because that hasn't happened and there is so much on the lawmakers' plates right now, what would you say to them about why this should be a priority for them to pass?
I would encourage and hope that they would be listening to constituents and see how many constituents have enjoyed a prior authorization process. I'm guessing not many.
Right.
This is, again, vitally important for an individual's health. It is important for our community health. I am excited and encouraged that there is a Senate bill companion, 1274, that has been assigned to committee. So that there is legislation proposed in the House and in the Texas Senate is encouraging. I think this is an important issue, and I hope that legislators will realize that and listen to their constituents about their personal experiences with prior authorizations.
Well, we will leave our conversation there, but of course we'll keep tracking this. Christopher Hamilton, thanks so much for taking the time this afternoon to talk with us and being here.
Right, thank you so much for having me.
We appreciate it.